One of the trials in progress that is presented here is frontline trial for patients with newly diagnosed advanced stage diffuse large B-cell lymphoma with the subtype that is nongerminal center subtype, which would have been called an ABC if you used in gene expression profiling. If you use immunohistochemistry, you would call it non-GCB subtype. The trial is important because this subpopulation of patients with diffuse large lymphoma represent an unmet medical need because they do worse when they are treated with standard R-CHOP chemotherapy. So their progression-free survival and overall survival is suboptimal compared to their peers who don't have this subtype. So there's a lot of interest in developing new treatments for this population, and most of them, at least at the present time, involve R-CHOP plus drug X or R-CHOP followed by drug X, so either concurrent or sequential administration of a novel agent. So the trial that is presented here is a trial in progress, which is adding the B-cell receptor signaling pathway inhibitor Ibrutinib to R-CHOP compared to R-CHOP plus placebo. So it's a randomized placebo-controlled double-blind trial targeting patients with diffuse large B-cell lymphoma of non-GCB subtype. I think it's an important trial because, again, this is sort of like a rationally designed trial, take into account the experience with single agent Ibrutinib in patients with relapsed diffuse large lymphomas, where the signal came from patients with the ABC or non-GCB subtype. Big difference in the response rate, 40% versus 5%, and that's the background for this trial. This is an ongoing international trial with approximately 800 patients that will need to be enrolled to find the answer.